Hi, good afternoon and welcome. Can everybody hear me? I'm Dr. Kate Telenko, and I'm the director of CapacityPlus, which is USAID's Global Health Workforce Project. And I'd like to welcome you today to our half-day workshop on retention and productivity of health workers. As many of you know, CapacityPlus has been active over the last 4.5 years in 23 countries. We have 80 staff who've really worked tirelessly to make sure that communities have access to qualified, motivated health workers. Really, there's been a lot of attention over the last few years on producing new health workers. And this is certainly very important, and most countries probably do need to produce more health workers. But perhaps an equally important task is to maximize the location and the productivity of the health workers that are currently in country, and that's what we're going to talk about today. For too long, countries have taken a central planning approach to health workforce, assuming that health workers will go where they're told to go, work for the wages they're told to work for. But an introduction of a labor market approach to this thinking has really helped us realize that health workers are individual actors who have individual motivations, opportunities and plans. And by taking this into account, countries can really maximize the health workforce that they have. By looking at the motivations, one example that you'll hear today from Wanda Jaskowitz shortly is our work in discrete choice experiments. And this is using an evidence way to design retention packages and make sure that health workers are where they're needed to be. And this has been used in both Uganda and Laos to design retention packages that have actually been implemented and has been used most recently in Namibia, and that the design of the package is currently underway. And over the past 4 years, it's been a privilege to work with the World Bank and Assist Project and to have them co-sponsor this workshop. And we look forward to advancing this dialogue. Today, we'll start with a panel with USAID, World Bank, and Assist, and then we'll go straight into the more technical content of the workshop. So the next speaker is Lois Shaffer, who's the Senior HRH Technical Advisor in the Office of Population and Reproductive Health at USAID.
And I have the great privilege of being the AOR of the CapacityPlus project, and I'm very pleased that I was invited to share a few thoughts with you. I'm going to reiterate a couple of things that Kate has already said, but hopefully I can expand on that a little bit so that we're all coming at this from the same place here this afternoon. Because as you might know, CapacityPlus is beginning to approach its end, and so having these opportunities to bring everybody together to start sharing what we've learned and figuring out where we still need to go, I think are really key and important steps in that process. So over the last decade, we've seen a lot of progress in HRH. It began with the Joint Learning Initiative in 2004. We had the World Health Report on the workforce in 2006. The Global Health Workforce Alliance was created shortly after that. There was the Kampala Declaration and Call to Action in 2009, and then the Lancet Commission report on health professionals for the 21st century that came out in 2010. And then most recently, we've had two very interesting and productive global fora on HRH, the Recife meeting, the third global forum on HRH held in Recife, Brazil last November, and then just a few weeks ago we had the PMEC, the Prince Mayadal Award Conference on transformative education for health equity. And so we're all full of great new ideas that came out of those meetings, and this is just yet one more way to disseminate those and talk about them a bit more. The report from Recife, which is called A Universal Truth, No Health Without a Workforce, and just thought I'd put a little plug in. This is on the Recife website. So this is the executive summary, by the way. This is not the full report. Highlights that there have been significant gains in HRH in the past decade. For example, countries that are most affected by severe shortages and that actually have data available have shown an improvement in the numbers of highly skilled health professionals that are available to them, which is a good thing. I want to put a call out to my colleagues from the population reproductive health world, however, to note that population growth in those very same countries is exceeding the increase in the number of healthcare workers, so it's a net sum loss. So please, let's not forget and keep going with our family planning reproductive health programs. We need that. But the report also identifies that this progress has been sort of uneven across different countries. And some of their key findings include that we need to get away from piecemeal and short-term solutions. We need longer-term that have political commitment, longer-term solutions with political commitment and investment behind them. We do need more health workers. The deficit is much bigger than we ever thought it was from a few years ago, so we are going to have to think about how we add to the workforce. But it's not all about numbers. We need to shift our paradigm to more explicitly focus on accessibility, acceptability, quality, and productivity of the health workforce, with equity as the center of the agenda. And I know those words resonate with all of you at different levels and in different ways. So we need to distribute the workforce more equitably. We need to create a workforce that meets user expectations in terms of profile, sex, age composition, its skills mix, and cultural awareness. Ensure the competencies of the health workers, and create an enabling work environment that motivates workers and supports their productivity. And you'll be hearing a lot about all of those aspects here this afternoon. The current focus on universal health coverage, coupled with the economic transition in many countries, brings us to a critical juncture for HRH. We're going to have to massively scale up services to achieve UHC, and the economic transition may liberate some resources to actually be invested in that scale up. The question is, what is the best way to use them? How most effectively and efficiently to use them? The scale up we're going to need puts additional demands on the health systems and the existing health workforce. And we need a greater understanding of how to improve health worker engagement, performance, and productivity in settings with resource constraints. So even if countries have more funds available, it's never going to be enough. So how do we use them effectively? And we have a real need to add to the evidence base. We don't have that evidence there of what works and what works best and how to use them most effectively. So at USAID, we actually take a comprehensive approach to strengthening human resources for health, addressing that human resource shortage across the system at multiple intervention points along the lifespan of the workforce. So we support things ranging from human resource information systems, their implementation and use of that data for decision making, HR leadership and management capacity building, strengthening the continuum of learning needed by the workforce. So we're talking pre-service, in-service, continuing professional development, task shifting, and just working to improve the workforce overall. And then finally, our topic for today, recruitment, retention, and productivity of the workforce. So we need to think beyond just adding numbers, but how well do we use the workforce we already have? So we have although we have quite a number of projects that work in various areas along the way, we have two projects that are going to be sharing a lot with you today, both CapacityPlus and the Assist project. And I'm going to let them talk about their work because they can do it so much better than I can. Except just quickly to say, CapacityPlus is our flagship project on HRH issues that works across the spectrum of policy and planning, workforce development, performance support on the job. Assist is our expert in quality improvement and taking those scientific methods that have been identified around quality improvement and applying them at the ground level and learning from them and building on them. So they have QI-based interventions to develop, test, and evaluate that improve health worker performance and productivity. And then, of course, USAID works closely with other donors and a wide variety of partners that include the Global Health Workforce Alliance, WHO, governments, academia, civil society, and a whole bunch of others to move that HRH agenda along. And a key partner, of course, is the World Bank. And so we are really happy that Akiko can be here with us today and bring their perspective into play and offer some ideas and insights into what they're doing, and we can hopefully identify some future points to continue our close collaboration. And a lot of our other partners are you folks right out there in the audience, and so again, let's keep the dialogue going. So I want to just tease you a little bit as I close with the idea that there is a process afoot on the global level to develop a new and improved, or maybe a first time improved, global HRH strategy. And so AID has been helping to facilitate, along with our partners such as the World Bank, a series of discussions and meetings. We got together in Recife, we got together again in Thailand, to sort of talk about what should be the priorities in that new strategy. We just started brainstorming. We wanted to look at issues around how to get concrete results and changes at the country level as much as have this sort of overarching global strategy. This is a process that what we develop out of this will contribute to the Global Health Workforce Alliance's own process of developing a strategy, working on a global strategy. So we'll all be partners in this together and marching forward in unison. We're all devoted to, dedicated to not having it be a fragmented and multifaceted approach, if I can call it that. So we're hoping, we've got some working groups going that some of you might have heard about. We're hoping we get some participation from a number of you. And then our next point of contact is going to be at, we hope anyway, at the Third Global Symposium on Health Systems Research in Cape Town in South Africa this fall, in September, I believe it is. So I'm going to be quiet now and let some others talk, and even then we'll move on to the bigger group discussion, because that's really what this is going to be all about this afternoon. Thanks.
Thank you, Lois. And our next speaker is Dr. Akiko Maeda, Lead Health Specialist and the Health Anchor of the World Bank. Akiko.
Thank you. Thank you very much. It's a great opportunity and privilege to be with all of you today. It's great to see many of our old friends and colleagues. I'm delighted to be here with the USAID and CapacityPlus and Assist and other partners, because we really have been working already quite closely on a number of issues, but it's also time that we started to disseminate and share what we have been doing to a broader group. So this is a very important meeting to start to share our activities. Since Lois has done such an excellent job in providing a background on the global HRH activities, I would just focus on where the World Bank is right now, because we are also undergoing major restructuring and repositioning of our health activities. And with, of course, President Jim Kim coming on board, our activities have really quite skyrocketed. Mm-hmm. And it's something that we absolutely cannot do alone, and we look forward to working with all of you. Just as a background, many of you may know, but President Jim Kim last spring at the meeting, at the World Bank IMF meeting, committed the World Bank to eradicating extreme poverty and boosting shared prosperity by 2030. By eradicating extreme poverty, you know, the $1.25 per day, how do we get it down to a really small percentage by 2030? We're making good progress, and that's one key area. By shared prosperity, he's really focusing on the lower income groups. We're discussing whether do we focus on the lower 40% with respect to rest, but the idea is to ensure that when there's economic growth, we're moving away from the old Washington consensus that fast economic growth is good, whatever it is. No, in fact, a sustainable and inclusive development is what we're seeking. And therefore, what we're looking for is a performance of a country, not just growth, but shared growth, meaning those who are in lower income groups are growing faster than the rest so that the gap is being reduced. And as part of that, President Jim Kim sees healthcare as a critical element to contribute to that. And as you know, healthcare can lead to catastrophic out-of-pocket payments. How can we, as part of eradicating impoverishment, to ensure that there is a system in place, which is both health system as well as social protection system, to protect the low-income population from the impoverishing effects of catastrophic medical expense. So that's one of our priority goals. And by shared prosperity, obviously we want to ensure that all families have access to health care when they need it. The UHC therefore fits very well into that context. But we wanted to go beyond that. We're talking as a World Bank about employment, and meaningful and sustainable employment for all, of which healthcare service industry is a very important growth area. How can we ensure the growth of this sector in a way that's equitable, that is sustainable? It's a sector that's prone to, rent-seeking behavior, if I may use the economic terms, but it has had market failure problems. So how can we make it grow so that it creates meaningful employment, especially among the underserved community? So it's not just about expenditure and welfare and support system. It's really an engine for growth as well. So how can we contribute? And in that context, HRH, health workforce, becomes very critical. It is a service sector that has huge potential for growth, and as was mentioned by Kate and Lois, there is a huge population growth. So how can we make sure the healthcare sector is growing to meet those demands as well, but to do it in a responsible and also in an effective way? And in that context that we want to work with all of you on finding, exactly as Lois said, going beyond just the production and the numbers. How do we treat the health workers not as a point in statistics? They are individuals with their own aspirations, with long-term career perspectives. How do we link them with their life cycle of their careers? How do we ensure that their incentives and behavior aspects are taken into consideration when we develop our policy interventions? So it's in that context that many of the points that are being discussed today in terms of improving effectiveness, of performance, of recruitment retention are all part of that. We are three areas that we're getting into that directly address this. One is in terms of labor market analysis. Our other colleagues at the World Bank are very active in doing employment surveys, looking more broadly at the employment sector, and linking that with higher education, secondary education, skills development. And there's a lot of misalignment there, so how do we look at that? And this includes the globalization of the labor market, the regionalization of the labor market, so we need to have evidence and information which we're lacking on what is really happening with the labor market, and so we have a better understanding of the aspirations of the workers that we are engaged in. So labor market is a huge agenda for us, not just for health. In terms of the behavior responses, I'm happy to see that Ken Leonard is there, but next year's World Development Report is going to be on behavioral and psychological economics. So as a World Bank, we're trying to bring in the evidence of behavioral sciences more directly to inform. This is not just for health, but health is a major chapter in this, and I'm sure Ken can say more about that, but we're very happy to be taking this forward. And as part of this, one of the instruments that we're introducing here, the discrete choice experiment, is a way to get a more systematic understanding of the stated preferences of workers. Again, it is not the actual final preference that they will actually exhibit in the long term, but it does provide some of the understanding of what the worker preferences are as one of the inputs. Down the line, we obviously want to have more longitudinal cohort studies to see whether these interventions did indeed lead to better recruitment retention. But at the moment, for low and middle income countries, we have very little evidence. And can we wait for another 5-10 years to follow a cohort before we say anything? I mean, I think this is where the trade-off comes in. We're trying to do the best within a very limited resource space, but understanding some of the limitations of these instruments. We would also like to look at the education and performance incentives. So we have, as you know, results-based financing as a project platform around which we can develop a way to incentivize workers and make them also accountable. So I'm sure that Dr. Rashad will speak more about this, and we're talking very closely with Assist on this. But how can we use platforms like results-based financing, which so far has been focused very narrowly on fee-for-service for certain, not too much on the quality, just increasing utilization. How can we improve on that to really, include some of the effective, clinical interventions as well? And it's a tall order, but we have to move in that direction. So again, another instrument where we hope to engage closely with you. So there are many areas in which we've been working also within the World Bank as separate activities. We'd like to also try to bring them together to have the synergies, and how we ultimately affect and ensure good healthcare and public health at the community level. That should be our ultimate measure. So we should all work together and collaborate. And so I really thank Kate and the colleagues at CapacityPlus and also USAID for putting this together, and look forward to our discussion. Thank you very much.
Thank you, Akiko. So our next speaker is Dr. Rashad Massoud, the director of the SIST project. Rashad.
Thank you very much, Kate. Well, let me start by saying it's a real pleasure for us to be here and to be involved not only in this meeting that is specifically focusing on productivity and retention of health workers, but to be involved in this whole effort. I want to thank key leaders who are spearheading this work, the CapacityPlus project, Kate and USAID, Louis and Estelle and Diana and many others, all of you in the room, for homing in on such an important area. From our side, I think it's very important to bring all the thinking together, and I'm thrilled to see Akiko with us and to be engaged in a conversation about how can we further develop this important technical area jointly with the World Bank and Akiko in person. Let me sort of go back to where the ASSIST project comes in, because CapacityPlus is the lead on health workforce. What we do is focus on improving care. And when I say improving care, I'm talking about outcomes of care, talking about if we can't measure the outcomes, then certainly proxy outcomes, things like degree to which we can be compliant with evidence-based practices, high-impact practices that ultimately do affect those outcomes, particularly when we talk about some conditions which, like NCDs, where it's further along. Certainly, we won't be able to measure the outcomes directly, as in some other areas. We're also looking carefully at efficiencies of care delivery. That is, how can we reduce waste? How can we remove redundancies and streamline the work in such a way that not only do we get better results, but we also get them for less? And I think my colleague Edward will be addressing this in a little bit. One of the key things about improving healthcare is this, that the results that we get are actually a characteristic of the system that produces these results. That is, the step sequence in which we do the work that we do in order to produce that. So if what we're interested in is getting better results, then we have to look at everything that happens in that step sequence in order to get those results. Now, as we look at the step sequence, there are people, health workers, individuals who perform different activities within those steps. And what really is happening here is this, that it's what each one of them does individually, that is the practices they implement, whether they're the best known practices or not, are they evidence-based or not, are they doing things that are not necessary, etc. At the individual level, and then the interactions that happen between the different individuals that ultimately yield the results of interest. Now, if we start to look at quality care that way, then the performance of the health workers within the systems of care delivery becomes a very critical part of it. So we need to base our work on the best evidence that we have. That's the good science, the medicine that we know. We need to organize the step sequence in such a way that allows it to happen, and we need to make sure that the people who are actually the heart of making this happen, one, have the knowledge, two, are actually competent in using that knowledge, have the resources that are needed. They have the time, they have the equipment, the supplies, the materials that enable them to do that good work. We need to ensure that the interactions between them, and here it's not just at a single delivery level, we're talking about across the levels of care. So not only do these things have to happen in the community by the health workers, they have to happen in the facilities where we have more qualified health workers in different professions working there. They have to happen at the district, at the national levels. All of those together with the support from their leadership, or lack thereof, if we don't have that support, together with the rules and regulations that govern the way in which these processes and the whole health system operates, that's what gives us what we're interested in, the good outcome of care. And at the heart of all of this are the people who are doing it. What we're looking at is how can we create the alignment of stars that yields the best results that we can get, that is consistent with the best knowledge, that then gives the people who are performing this work the reason why they went into the care profession for in the first place, which is to do good care, provide good care, do good service, save lives. That's what they went into the healthcare profession for. Homing in on what makes them more productive, on what retains them and engages them, is at the heart of what we're trying to do. And I'm very happy to see that all of us here, multiple partners, are joining forces to try and further this area of knowledge. And I look forward to today's meeting and the continuation of these efforts and to the new strategy that is being developed. Thank you.